4 gear, and that lets you save.
Look here.
True Form Life.
Green look on it.
Welcome to Exploring Mind and Body with Drew Tadia. Drew is an expert in nutrition, fitness, lifestyle, and more. And he wants to help you live a healthier, longer, and more active life. Now here's your host, Drew Tadia.
Welcome to another edition of nationally syndicated Exploring Mind and Body. Thank you so much for being here with us. Thank you for being a part of our True Form Life community. We certainly wouldn't be here without you. Today I'm bringing on Dr. Anne Marie Barter, and today we're talking about chiropractic health in a number of different ways. She takes a slightly different approach. I would say maybe a more holistic approach or more overall approach to natural health. She looks at nutrition. She looks at lifestyle. She looks at the way you're living your life. And I think that this is a great way to look at chiropractic health. She's going to talk about pain. She's going to talk about the benefits of chiropractic health, how she got into what she's doing, and her love and passion for helping people improve their health and lives. Sit back and enjoy. We got all that coming up on...
This is Exploring Mind and Body. Naturally improve your lifestyle one show at a time with your host, Drew Tadia.
All right, welcome to another edition of nationally syndicated Exploring Mind and Body. We have Dr. Barter here with us. Welcome to the show. Thank you so much for being here with us.
Thank you so much for having me. I'm so excited to be here.
I'm excited to have you. Today we have a lot of things to cover in a short amount of time. Why don't we talk to our audience first? Give them a chance to resonate with who you are, what you do, and how you got into it.
Hi, my name's Dr. Anne Barter, and I am a chiropractor and functional medicine doctor out of Denver, Colorado and Longmont, Colorado. I got into this, which is a common question, based on my health history. So a long time ago, I remember going to a primary care, and I went in and I had problems with acne, and I was having problems with my period cycle and everything else. And I went in and described these complaints to my primary care at about, 14, 15 years old. And she said, basically, your period cramps are normal. Suck it up. You're a woman. Deal with it. And the acne, she said, you know what? My neighbor sells Differengel. And for those of you that don't know what Differengel is like a topical acne treatment. And it didn't work. So I went back in and said, hey, it doesn't work. And she said, well, we can put you on Accutane in birth control. And I just wanted to pass on that. I just felt like something wasn't right. She said my lab work was perfect. I was 100% normal. Nothing was wrong with me. Yet I was having all these symptoms. So fast forward a couple years, I remember waking up and going into my mom's room, and I said, hey mom, I'm really struggling today. My period cramps are really, really bad. And I really need to stay home from school. And that was really atypical for me at the time. And so she said, no, we're going to go to the doctor, a different doctor. And anyway, it turned out that my appendix was exploding, and it wasn't period cramps, but it all felt the same. So and the whole time as they're removing my appendix, they're telling me I'm perfectly normal. There's totally nothing wrong with me. So, and it ended up to be like those struggles with my health that actually got me into this today, in understanding food allergies, food sensitivities, and why I was having so many problems with my skin and my period cramps and everything else that made me want to help other people like me, struggling like me, that were told that they were perfectly normal when their labs looked normal and everything else. And so that's how I got into this.
So what was the journey? How were you like, I need to help other people with these same issues? What was the next step to being a professional?
So after I ended up having my appendix removed, I went to college, and I was going to study business, and I was so excited I was going to be the executive of a big Fortune 500 company. And in the process of that, I started breaking out with hives. And so the hives ended up to be like dietary sensitivities. So while in college, while I'm studying business, I ended up going to a couple different holistic doctors and understanding more about my body and my system. And as I graduated college, I walked out and realized that I absolutely hated corporate America. So I started working at Lockheed Martin, and I remember walking into the sea of cubicles and being like, this is not for me. Like, these politics are not for me. And it was a great job, and I don't want to speak ill about it, but for me, I needed something more. I remember going home at night and feeling like my soul was dying. And I started doing my prereqs at night for doing this because I was so inspired by all of the alternative medicine doctors that helped me and actually made me whole. And so here I am many years later.
Explain what chiropractic care is for us.
So in my practice, I do a variety of hands-on adjustments to get the spine in line. And then I also do low force. So ultimately, it brings the body back into alignment. So when you think about simply, like if you think about posture, like the way that you sit, and if you sit really hunched over, you're going to affect your internal organs. So your back and your spine are really, really important. You can't get a spine. You can't fix really the spine other than, I think, chiropractic care or really invasive surgery. So number one, it affects the nerve roots. We also do a variety of techniques that are Grafton, which is scar tissue removal, where we can help with old injuries, those injuries where you quote unquote feel old because you're stiff and you wake up in a certain way. We also use dry needling, which is a form of, it's not acupuncture, but you're using an acupuncture needle. So we do that to help to treat the muscle, to treat the tight muscles. And then we also use cupping, which probably the most famous use for cupping. You've seen Gwyneth Paltrow in her dress, and there was cut marks, or Michael Phelps in the Olympics. So with all the cut marks, I think he really put it on the map for us. But cupping really, really helps the fascia and helps to loosen things up. And so just getting the body back together as a whole, as well as doing the nutrition part of the functional medicine.
True Form Life.
Before we get into the show, I just want to mention Complete Truth Protein. This is a plant-based protein supplement that we've designed ourselves at True Form. And the reason I designed it is because I felt like there was a need in the industry. Now, when I was traveling around the world, and I literally had a tackle box full of supplements and products and vitamins that did a whole lot more damage than good. So when I started doing more personal training and fitness classes, people would ask me what types of supplements I would recommend. And I always say, eat food. So that's why I've designed Complete Truth Protein around food. It's made with quinoa and hemp seeds. And one of the main benefits that it offers is improved digestion. So many of us deal with digestion issues on a regular basis. It also gives you a natural boost of energy. So if you head over to trueformlife.com/complete truth protein, we have tons of more details, videos, recipes, and everything you need to get going in the right direction with a good quality protein supplement. trueformlife.com/complete truth protein.
True Form Life.
So is this different than a conventional, I don't know if you can call a chiropractic conventional in any way, but would other chiropractors do dry needling, cupping?
Some do. So, I mean, we're kind of a mixed breed. We definitely have our own way to treat, and there's no real right way to treat. I do a pretty comprehensive treatment. My treatments are very long. So we spend 30 minutes. I'm in the room for 30 minutes on a follow-up appointment and an hour on an initial. The problems that I see tend to be more complicated than just like, oh, hey, my neck went out. They tend to be more complicated. Years of wear and tear, heavy-duty car accidents that people couldn't fix. So I see the complicated cases.
Okay, so tell me what dry needling is. Can you give me some more details?
Okay. Sure. Dry needling is where you use an acupuncture needle. It's like in an acupuncture needle, for those of you that don't know, is a very, very thin needle. Like it's the size of your hair. And so what you do is you're going to insert that into like a muscle. So in acupuncture, it gets confused with acupuncture a lot. In acupuncture, they're treating a diagnostic system with these needles. What we're doing is we have a tight muscle. We have a muscle that we can't quite get to relax, and we will dry needle into the belly of that muscle to get it to relax. So it's easier to get in there deeper with the dry needling, if that makes sense. Mm-hmm.
Okay, and tell me the difference or the benefits, the added benefits of the dry needling as opposed to just the chiro. I don't mean just the chiro.
Sure. Yeah. So I believe everybody has a different philosophy, in practice. And so what I believe is you have to treat the structure, but I also believe you have to treat the muscle. So that's why I think you need to do scar tissue, cupping, and the dry needling in order to treat the entire person, because I don't want to see a patient 3 times a week. I don't really even want to see a patient once a week. I want to be able to treat them, get them feeling better, address the areas that need to be addressed, and then send them out so that they can, bend, lift, twist, and do what they need to do without something constantly going out. Does that make sense?
So, well, I guess it's just more of a holistic or more of an overall approach as opposed to just treating one angle.
That's right.
What you're saying. So, and then do you do nutrition as well?
Oh, yes. Lots of nutrition.
Okay. So when someone comes in and they say, or you talk about their lifestyle and what they're eating, they're putting in their body, how do you assess their nutrition as well?
So one of the biggest, I use labs. I actually use the labs that you would run through a primary care. So you have what we call a CBC or a CMP. A CBC is a complete blood count. It's where you have like white blood cells, red blood cells, and all of those markers. And then you also have a CMP, which is a complete metabolic panel. And that's where you're looking at glucose and AST and ALT, which are liver enzymes and kidney markers and kidney function. And so all of those things give me a snapshot of what's going on with that patient. So I can see if they have a lot of inflammation in their bodies. So if they have a lot of inflammation, that's going to play into what I do into the structure, right? Because I need to get the inflammation down for them to feel less pain and to heal. But a lot of people are coming in because we work with a lot of autoimmunity, which is like, for example, Hashimoto's. And those people come into our practice because they have a lot of pain or discomfort. And Hashimoto's is where the thyroid gland starts attacking, or the body starts attacking the thyroid gland. It's autoimmune thyroid. And so those patients will present with headaches and a lot of pain. And so they think it's a chiropractic case, but it's really something else going on in their body. So we try to address, is it just structure? And we can address that. Is it structure and metabolic? What else is going on so that we can address the person fully and get them better faster?
So how do you address the situation or the topic that comes up around cracking, quick movements, adjusting? I'm sure you've heard it in your field. Some people are in fear. Some people probably lack some knowledge, not really sure how that works. Can you explain or ease some minds for us?
I mean, cracking is just gas being released. I mean, so it's really, there's nothing dangerous about the quote unquote cracking. When you move in daily motion, your body does crack. Like you'll notice that if you go to a yoga class or you're doing a side twist, your body will crack, and that's natural for it. If it needs to actually crack, it will, but it's just gases being released. So there's nothing to be afraid of, but I always sit down with patients and ask them if there's anything they're concerned about. What can I do to ease their minds? And I definitely get their fears or concerns on the table, and I address those one by one. And some people you have to build trust with them for you to be able to work on their body in such an intimate way, because it's really, really hands-on, and some of that is a little bit vulnerable. So building trust, I feel like, also helps a lot in that scenario. And when people are ready, they'll also let you adjust them where they've never let anybody adjust them like that before. But I think it's also about gaining trust and having them trust you as well, and mitigating their fears or concerns. Like, what around cracking scares them? What is it that really bothers them about that? Did they have a bad experience before? I feel like you have to address those complaints or concerns.
True Form Life.
Just want to take a minute to mention Complete Truth Protein again. This is a protein supplement that we designed at True Form. We believe in food. We believe food heals, cures, and prevents. That's why this product is much different than your conventional types of products. Unfortunately, packed with chemicals, preservatives, toxins that our body doesn't know how to utilize, digest, and absorb. So that's why Complete Truth Protein can help improve your digestion and will offer a natural boost of energy. You can find more details at trueformlife.com/complete truth protein.
Trueform Life.
So sometimes there's different treatments or different forms of chiro care. That should be on a t-shirt. You have the click, like the clicker. Tell me what is that?
So it's an activator is what they call it. And so that has a whole treatment protocol around the activator. So I use a device that's like a clicker, but it's like an electric clicker. It's like
that sounds like a taser.
Same idea, right? So you don't have to click it every single time. It's just more automatic. And so there's just different philosophies. Some people feel like you don't need to adjust to get an impact. Some people really like to adjust. I think it comes down to really preference. You can get the job done either way. I personally love to be adjusted. I don't love low force, but I do low force in here. But everybody's preference is different. So what's your preference? Do you like it to be adjusted or do you like the low force clicker?
I don't know. That's a good question. I feel like the click. I don't know. Like I feel like the clicker is not like I don't feel like, you know what I mean. Like I don't feel like I'm being adjusted, even though I may be, or you're telling us that you are. I feel like I get more out of it if someone's actually doing some more. I don't know how. I don't know what I'm saying. Right. You know what I'm saying?
Right. And yes, I do. I feel like you definitely I feel like I get more satisfaction out of really feeling the joint move and really feeling the muscle relax when I get that crack or that pop. But a lot of times if someone's incredibly inflamed, it hurts them to be like really, the set it can be hard and it hurts them to have that set. And so they prefer a lot of times a more low force option. Again, I think that goes back to like what's going on in labs. If someone's really inflamed, that's why they prefer a lower force option.
Yeah. And I mean, whatever's best for the individual, like I wouldn't say don't do this. Like I think if they're comfortable, but we're talking about that emotional satisfaction when you go in there and you want to have it. But I think that's kind of a challenge when you go in for just a few minutes. And I've had this conversation a handful of times and they go like, are you really getting anything out of it for a few minutes? And I said, well, it wouldn't be sticking around this long if you weren't. And I think that most people feel like you go in and your back or your neck isn't really feeling right. And whether it's a few minutes or 30 minutes, you feel better after. But I think it's that emotional appreciation of spending more time with a patient or client.
Yeah, I think that helps, but I also think treating the entire body. I mean, I'm not really just hanging out in here. I have a lot to do, like between the nutrition and making sure that they're doing okay. Because again, my problems are more complex. Like back pain, yeah, it's a lot easier of a case. But when you have back pain, when you have fatigue, when you have constipation, when you have somebody that can't sleep, and then you have somebody that also has a foot problem or a gait problem, I think addressing all of those in 5 minutes is too complicated for me because I don't feel like I get the full picture.
Yeah, and it's usually not just like there's always underlying issues. Like it's not one thing. Like when you come in there and your back's not feeling well, it's not your back. It's what happened before, right? So I like how you're addressing that. If you're not addressing that, then you're really not preventing. You're just kind of, I feel like, putting Band-Aids on in a different way.
I really wanted to see people live their life and actually get to their goals, like the things that they never thought that they could do. Like I never thought that I would be able to walk this far because I have such pain and I have such fatigue and I can't do these basic activities that I realized initially that I've taken for granted, because I can do a lot of these things because I've been under care for a really long time and taking care of my body. But it's incredible to see that. I never want to take that for granted because people really struggle.
Do you get adjustments yourself?
Oh, yeah. Yeah. I'm a firm believer.
How often?
So I get adjusted every 2 weeks.
Okay. That's where you found what do you recommend for your clients? I'd imagine it's different for everyone, but what would you recommend for the average person that maybe they're trying to prevent as opposed to have an injury or treat?
People that are in really good place and that don't have really any problems overall. The reason I get adjusted so much is what I do every day. I mean, I have to prevent the problems with posture and everything else because I'm leaning over and working on people all day. And I'm also a mountain biker, backcountry skier. My lifestyle's kind of extreme. So lots of falls and injuries. If somebody doesn't really have any problems and they feel good and they're not having pain between treatments and their tissues overall feel great, for maintenance, I recommend a month to 6 weeks is when I see people. And if they have problems, if they notice anything, I recommend they come in. But I kind of have a discussion with the patient about what they're comfortable with. But generally, I see once a month really keeps people out of problems, especially people with desk jobs. Driving a desk is actually really hard on your body, believe it or not. A lot of repetitive stress, a lot.
True Form Life.
I just want to mention Complete Truth Protein here once again before I let you go. This is a protein supplement we designed ourselves, made with quinoa and hemp seeds, also maca and stevia. We have 2 different types of products. They both have tons of health benefits. You can bake the original bag you can bake with. It's perfect for gluten-free flour. If you're celiac or gluten intolerant, we have tons of recipes on trueformlife.com. which include raw protein balls. People absolutely love these ones. We have pancakes, cookies, muffins, all healthy, all clean ingredients. Dorothy puts these together for us on a weekly basis. So if you head over to trueformlife.com, head over to the recipe section. We have all kinds of recipes on how you can use Complete Truth Protein. It's also a vegan and raw product. So if you have any intolerances or if you have any issues with digestion, this will definitely help you out. Once again, that's trueformlife.com/Complete Truth Protein.
Trueform Life.
Why don't you talk about is that would be a specific or how do I say it, an ideal client that someone comes into you and they probably live a sedentary lifestyle and they sit in front of a desk. I'd imagine those people have more issues than those that are active and doing things outside maybe.
Yeah, you're correct. It's very, very challenging. And a lot of folks get kind of fatigued and stuck in the routine of potentially like their office job. It tends to be busy, tends to be stressful, and it's hard to motivate those people to want to work out or to move their body because we know that chiropractic care is very effective, but it's passive. Exercise is active care. And so we know that exercise with chiropractic are where people get the best results. So the cases that where they won't work out or do anything for themselves actually tend to be kind of hard to get better. You tend to see them frequently, like every 3 weeks, because they don't want to exercise. And even though you tell them how much better they would feel overall, a lot of times they're just not interested.
Tell me about some of the added benefits, maybe some things that we haven't mentioned, those that are dealing with the different types of issues in their life, maybe chronically, maybe acute. What can you tell them that chiropractic care has to offer?
One thing that I noticed, I think first off, you start to get used to feeling stiff or uncomfortable, like when you don't get adjusted or when you don't take care of yourself. Also, the other thing that I've noticed is I can actually work out better. I can work out longer when all the muscles in my body are firing. So for me, I mountain bike or I backcountry ski. And so I'm a lot faster and a lot stronger and I have less injuries when I do preventative care. So that's another thing. It increases your circulation. So it's going to move the tissues around and increase your circulation, keeps the muscles healthier. And there's no such thing as a spine implant. And the way that we move, lift, and twist, we're constantly doing damage to muscles and to our bones. And so how it progresses is you'll create scar tissue, and over a long period of time, you ultimately can create arthritis. And I do not want arthritis. I do not want to be walking around with problems and inflammation in those areas. And so that chiropractic actually prevents the arthritis that people are so afraid of in all joints, extremities, like your wrists, your elbows, your shoulders, and also in your back as well.
So for those that want to avoid, like, do most people deal with arthritis on some level as they age?
Yeah. Absolutely. Yep.
Is it like osteoporosis or different?
Osteoporosis is bone thinning.
Right,
So
which
that's
most
like
people
more-
deal with. Well, everyone deals with.
Yeah, but arthritis, like more of the population deals with. It's when your bones kind of fuse together, or you'll get bone spurs, and you'll see people be like kind of hunched over, really far hunched over in their back, and you'll see that hump on the back of their spine, or that they can't move and they're getting stiff. Yeah, most people really ultimately have a lot of arthritis as they age, and they call it, oh, I'm just getting old. That's not true. You can actually prevent it.
And so if someone were to come in to use chiropractic on a regular basis, is that something that it would help them achieve? Like, how does chiropractic help with arthritis? So with arthritis, for example, do our joints, they're harder to use and bend and work?
Sure.
Is that right?
But let me tell you about the progression so this makes a little more sense. So let's say you have an injury. Let's say you're driving a desk and in an area and your back gets stuck. And we all know when an area gets stuck. And so what happens is the segments above and below it move more to compensate for that loss of the mobility, right? And then ultimately your body's like, hold up. Wait a minute, those two segments are unstable. So what we need to do is we need to lay down some calcium deposits to stabilize that area so it's not moving so much. And then that's when you start to get arthritis, right? So that's when you'll start to bone spur and you'll start to see it going to that. And so what you'll notice is ultimately stiffness, and you'll notice bone changes in your back. Like you'll notice that hump when you're slouched over and you can't stand up straight, and then it hurts to stand up straight, and all those types of feelings, and it's more painful, and you acts like a barometer for the weather when it's coming in. When it gets cold, you hurt more. Like you'll see a lot of older folks move down to warmer climates because it feels better, because the cold actually hurts them. It's painful. So you'll see a lot of those things with the osteoarthritis. And this is not rheumatoid. This is not something that is an autoimmune disease. This is due to wear and tear.
I grew up in Canada and I've never liked the cold weather. Does that mean I have some form of that I don't know about?
Wait, so you like it or you don't like it?
No, I dislike it. I've never really liked the cold. I've always enjoyed being in warmer climates.
That's not what I'm saying. I do. I mean, I prefer the warm too. I'm a sun baby, but because Colorado can get really cold. But no, it's when you ache. Like you just can't stand being there because you ache. I mean, is it because you hurt because of the cold? Do your bones hurt?
Oh no, I don't know.
Not
they do medically. I need to be in warm weather. I need a doctor's note. Can I get a doctor's note?
This is a condition. Oh, I love you Canadians. You guys crack me up. You guys are the nicest people.
So we do have to wrap things up here. Tell me more about if people are interested in your website, if they want to get a hold of you. How do we get more details?
Sure. My name is Dr. Anne-Marie Barter, and my practice name is called Alternative Family Medicine and Chiropractic out of Colorado, both Longmont and Denver. We have all of our socials and everything on our webpage, so I'm going to give you that. It's short for Alternative Family Medicine, www.altfammed.com. So reach out and you can connect with us that way, and we look forward to hearing from you if you need anything.
Awesome. Thanks so much for joining us. That was a blast.
Hey, thank you so much. Really appreciate it.
True Form Life.
That's going to wrap things up for this edition of Exploring Mind and Body. As always, thank you so much for being here. Thank you for tuning in and being a part of our True Form Life community. I hope you enjoyed that show. I hope you got something out of it. Always great takeaways from these interviews we're bringing on Exploring Mind and Body. If you missed any of the past shows, you can always go back and check out past shows on exploringmindandbody.com. We also have a free app that you can download on any Apple device. So head over to our app store, search for Exploring Mind and Body, download our show, and take us with you wherever you go. More details are at trueformlife.com. This is our main website where we do meal planning, recipes, grocery shopping lists, and more. At-home workouts, videos, that's what we do. If you need any help, if you need any direction to get going, we can certainly help you out. Once again, thank you so much for being here. That's it. That's all I got. I'm out of here. As always, I'm your host, Drew Tadia. in health and fitness for a better world. Thanks for listening.
You've been listening to Exploring Mind and Body with Trueform Life's Drew Tadia, fitness expert. To find out more about the show, Drew Tadia, or to listen to past shows, visit exploringmindandbody.com.